big part of connecting to our pelvic floor is learning how to use our breath and our diaphragm to help us find our pelvic floor, connect with it, and get some mobilization, and get that pelvic floor moving through its range of motion. And its range of motion isn't a flexion and extension or a bending and a straightening, but it is an up and down. So the pelvic floor, if it's here, we're standing here, this is our pelvic floor. Our pelvic floor needs to move down and then to move back up in order to maintain continence, to help us manage all of the pressure that is up here, and also to help to work to stabilize our pelvis. So how can we get that mobility when we're not really even sure where these muscles are and how to find them? One way that we teach is to use our diaphragm, which is right underneath our rib cage here, to help. Because our diaphragm, which is up here in our model, so if this is here in my body and my diaphragm is here, as we breathe and that diaphragm moves up and down, our pelvic floor moves with it, moving up and down. So if we can figure out how to breathe more with our diaphragm and more by helping that diaphragm to expand our rib cage, what we'll get is a little pressure down onto that pelvic floor, which is going to help mobilize that pelvic floor down to our feet, towards our feet, not to our feet, but just down in that direction, and open and drop. And then as we exhale, the pelvic floor comes back up. So inhale, the pelvic floor moves down, opens and drop. Exhale, the pelvic floor moves up. Inhale, exhale. Inhale, exhale. Inhale, exhale.